So in the morning, I am the audiologist for our oral deaf education school. And so the kids that come to school there have hearing aids, cochlear implants, or Bajas. So I make sure that their equipment's working properly. So if they come in and one of the teachers or speech therapists feels like one of their devices isn't working, they'll call me, I'll come down, do some troubleshooting, try to figure out what the problem is and fix it. If I can fix it on site, great. Sometimes equipment has to be sent out, so then I'll program loaner equipment for them to use. And so then I work on their equipment, and I also pull them for hearing tests. And we start with the early intervention classroom with the kids as young as 18 months to 2 years, and continue testing their hearing until they're 4 or 5 years when they leave the classroom program. In the afternoon, a lot of times I see clinic patients. So clinic patients can range anywhere from babies to adults that are 100 years old. And when I'm in the clinic, I do hearing tests, hearing aids, cochlear implants, specialized testing on babies that may fail their newborn hearing screening in the hospital. So a cochlear implant is generally recommended when a person has worn hearing aids and testing has indicated that they're not getting benefit from the hearing aids. So they do need to come in, see an audiologist at Buffalo Hearing and Speech, and be tested. Then once the test scores qualify them for the cochlear implant, we review the device with the patient. So there is an internal device that one of our local surgeons implants in the patient, and it goes kind of in back in the skull, and then part of it goes into the cochlea, which is in the inner ear. Then there is an external component. So there's a magnet piece that sticks to the internal magnet, and then the processor is slightly larger than a hearing aid, and that also sits on the ear. Lots of memories, but one is a particular grandparents that came in with their grandson. The grandfather had worn hearing aids for a number of years and was receiving no benefit, so he received cochlear implant, and his grandson was in visiting from out of town and wanted to come to the appointment with his grandpa because him and his grandpa were best buds, and he wanted to see what was going on with grandpa at the appointment. And so we turned the cochlear implant on, we did the activation, and during the appointment, I saw the patient, the grandpa, his eyes kind of well up and with tears, and I was like, is everything okay? And he's like, I can hear my grandson for the first time. And it just, very emotional.